now go down to the lower back, is comprised of 5 functional lumbar vertebral bodies and also the sacrum, which is fused together. And we can see here that this is the tailbone, this is a side view of the spine, and this is a front to back view, and we're looking at the spine from the back. You can see at each one of these levels, there's a bone with discs here, here, and here. And oftentimes, like I said, the cervical spine and the lumbar spine has a lot of motion, and that's why the majority of the disease that happens in the majority of individuals that have problems with their neck and back occurs in the cervical and the lumbar spine. It does not happen in the thoracic or sacral spine because the thoracic spine doesn't have much motion, and the sacral spine is the tailbone, and it doesn't have any weight-bearing capacity, or it doesn't have the majority of the motion like the lumbar and cervical spine does. This is a more up-close view of what we were just looking at, and you get an idea of the vertebral bodies and the bones here. So if you imagine this could be L lumbar 4, lumbar 5, maybe the beginning of the sacrum. You have the nerve roots or spinal cord traveling here, and you have the nerves branching off at each of these levels, going to the arms or legs, depending on which area of the spine you're talking about. This is an anatomy or a bone that looks more like a lumbar spine, but it gives you the general idea that there's a canal, and at each level of the canal, there's nerve root that travels to the right and to the left out of the canal, which controls our sensation and our function. This is a cross-section of the disc, which we look at here. So if you imagine the disc here, okay, this blue area here, and we go back here, there is 2 areas of the disc. There is an outside fibrous layer of the disc, and there is an inside nuclear layer. Now, you can think of it as almost like the jelly that's in a jelly donut. This outside layer holds this compressive liquid or gelatinous layer together. And when someone has a herniated disc, there is a tear of this hard fibrous layer, and this jelly-like substance can squirt out into the canal and cause compression and irritation of the nerve roots. So there are multiple initial treatment modalities that have relatively low risk and that can be used for treatment of spinal disease. Anti-inflammatories, which you can do over the counter, and there are prescription anti-inflammatories as well. Physical therapy, which focuses on range of motion, core strengthening, massage therapy, ultrasound therapy, and traction, and other modalities to try to alleviate nerve root irritation, teach patients how to take care of their core and their spine over the long term, and also teaches patients on positioning and how to go through daily activities without aggravating their neck and back. Epidural steroid injections work to control the pain and decrease the inflammation around a nerve root that may be irritated from compression from a disc, arthritis, from injury, and it will allow the patient to have not only some anti-inflammatory effect directly at the nerve root or the spinal cord region, but also a decreased amount of pain while their body heals. Braces work to stabilize patients. They're effective if there is an instability in the spine or if there's a fracture. So sources of pain of the spine there, and we call these frequent pain generators. So arthritis can be enlargement of the joints. So if you think of about an individual who has arthritis in their hands, they have enlarged knuckles. The problem is that when there's inflammation or increased arthritis within the spine, there's an economy of space. And when the joints enlarge, this puts compression on the nerve roots, and the nerve roots don't have anywhere to go. Stenosis is the way that we describe narrowing within the spine. So anytime that you see the word stenosis, just go ahead and think narrowing. And that is a very commonplace term that you hear a lot. You see it on MRI reports and also doctor's reports. Neuroforaminal stenosis has to do with narrowing. Once again, you have that word stenosis here within the nerve hole. So neuro means nerve, foramen means hole. And that's where we saw that there is areas where the nerve root exits on the right and left side at each level of the spine. And that's where you can see nerve hole narrowing or neuroforaminal stenosis. Degenerative disc disease is the loss of disc height that happens with age. It's very normal to have, but not everyone has pain because of it. And this can also be a pain generator in certain individuals. Facet disease speaks once again about this arthritic component that we discussed. Arthritis causes enlargement of the joints. The facets are one of the joints that are in the spine. And when the facets enlarge, this can cause a narrowing of the canal or stenosis and cause pain. So when you see here, this is the types of pathologic symptoms or symptoms that people may come in or explain that they have. They could have back pain, which is axial back pain describes pain just in the midline of the spine. Radicular pain is pain that radiates to the arms or down towards the feet. It also can radiate, if it's in the thoracic spine, around the ribs and to the chest wall. Loss of balance is the myelopathic symptoms that we were speaking about when the actual spinal cord is compressed in the cervical or thoracic spine. Loss of dexterity can occur from that same reason, and weakness can occur from any of the causes that we discussed before.